More and more parents nowadays are choosing to not circumcise their babies. But a lot of parents have questions about what do you do with a baby's intact foreskin? Is there any special kind of care you need to give it? Well, actually, there is nothing you need to do for a baby's foreskin during the first few years of life. In the old days, a lot of doctors felt that you had to forcibly retract the foreskin, pull it back bit by bit during the first year or two of life in order to help it become fully retractable once baby's older. We now know that's not the case, and that older practice was actually very painful and pretty traumatic on little babies. Now we know parents don't have to do anything with their baby's foreskin. You simply have to clean it like you do the rest of the diaper area. Foreskins really don't start to become fully retractable until a baby is usually 3 or 4, sometimes not even until they're 7, 8, or even 10. This usually is achieved once a baby starts exploring their penis themselves. When the baby's 1 or 2, most kids will start to play with their penis a little bit. And when kids are older, like 3 or 4, when they're in the bath, when they're going to the bathroom, they're typically curious. They'll start pulling back the foreskin, stretching it, pulling it. These are all very natural things that you should allow your young boys to do so that they eventually can retract their foreskin. But let kids do it themselves. Parents typically don't have to do anything for the foreskin in the toddler or preschool years. The foreskin will almost always naturally retract by itself. Now, there are some things parents should know about foreskins that are circumcised. After a baby has a circumcision, the foreskin that's left over is actually very irritated and raw, and sometimes it can get stuck to the head of the penis during the first few months of life. Pediatricians will check this and make sure nothing's getting stuck, and if it is, the pediatrician will gently pull it back to make sure it doesn't stay stuck. But parents can also pay attention to this as well. After your baby's circumcised, when you do change the diaper, pull the foreskin back a little bit. Any of the areas that are a little bit swollen or moving back up and covering the head of the penis, if you gently pull those areas back, prevent them from getting stuck during the healing process and during the first few months of life, then you won't have to worry about any foreskin getting re-stuck to the head of the penis.